Well, Happy New Year 2023, the first of our Lunch and Learn series on a Tuesday. You know, we've been here since last year doing Lunch and Learn and really sharing knowledge and having a great time meeting new persons who, got this thirst for knowledge. So for those of us for the first time joining us ever, welcome. For those of us who are joining us yet again, welcome again. We're happy to always have you with us. I am Shivani Sinarain, and as usual, I'm here to introduce a facilitator who will be bringing us some great knowledge on a Tuesday, 12 p.m. our time, EST time, right? And of course, it's great to keep doing this and keep joining us. We're so happy that you keep joining us on Tuesdays for a Lunch and Learn series, where Caribbean Connect is all about sharing knowledge, is all about improvements. And, as those of us who have come into our sessions from last year to now, I hope that you do agree. It's all about learning on the go, because you could be in your car, you could be in the airport, you could be at your desk, wherever you are, and you're learning something new. Learning and development of persons, keep persons, as we say, Hazel, keep you feeling young, keep you feeling vibrant,
Very true.
Make you feel that you're somewhere that you're not. So thanks again to all of us for continuously being part of this wonderful conversation on Lunch and Learn on Caribbean Connect. So let me introduce Hazel. Who is Hazel? So Hazel Bain, some of us here on the call would have known her in a longer period of time than some of us, since we have already run on Caribbean Connect. We've run a number of wound care programs, and it was such a great interest. I'm seeing some students also participated in that program. Actually, Hazel back with us here again. And I know for the wound care, we have our level 2 to launch. So wound care is, I would say it's a particular training that is of great interest to people. Sometimes DIY, you want to learn how to do it for yourself rather than having to go to a doctor. It's always of key interest, this aspect. So Hazel, thank you for joining us again on our Lunch and Learn on Tuesdays. So who is Hazel, for those of us who don't know who Hazel is? So Hazel, many years, I'm not going to say how many years, Hazel, because people might figure out how old we are, right? So many years as a nurse practitioner. I have personally known Hazel for a long time. And, I'll always remember Hazel having this care. She has this care for people, in terms of you have a problem with your hands, something medical oriented, always. I remember she's always telling me certain things about me, what to eat, what you shouldn't eat, what you should drink, how you could do this, what you shouldn't do. So Hazel has this care for person. She's trained as a nurse for many years. She's not also in a nursing profession. She has lots of experience in many different areas. So me saying that, welcome Hazel, welcome. We look forward for rolling out our new programs in wound care level 2, and also starting our wound care program at the ending of the month, the level 1 again. So thank you, Hazel. Over to you, Hazel. Welcome.
Okay, thank you for that, Shivani. Thank you for so many of you all turning out today. Just to give a little brief synopsis about myself, I became a nurse in 1989. Yes, that's just the other day. And
yes.
At that point in time, I wanted to become a nurse to make a difference. I felt that it was important for proper healthcare. I've always had this desire to do something in healthcare. And when the opportunity came for me to become a nurse, I snatched it with both arms. While being a nurse, I realized that there was a great need for proper treatment of wounds. Because over time, you look at things and you look at people, you see certain people having amputations, and you're wondering, why was that necessary? You see persons coming to the clinics regularly, repeatedly for many, many years, just having this one wound that never seems to heal. And all that would be done at the clinics would be to bandage it, change the bandage, change the dressing, and send them off. I decided upon myself at that point that there had to be more that could be done. And for that reason, I went into researching on my own wound care. Trinidad, sadly, is deficient. We had a lot of money flowing, and yet still the money was not channeled in the right areas. Sad to say. So they could have done a lot more. We could do a lot more as a country, but we are not doing that. Anyway, I sought out what I felt was the best treatment courses, and I've improved on it over the years, because nothing in medicine stays stagnant. Medicine is an ever evolving, ever changing, ever mutating program. What is good or acceptable today, 3 months along, they'll tell you it is not as good as we thought, and we can make improvements on it. So for that reason, wound care has to be, as all other branches of medicine, has to be a continuous process. It has to be something that you have to improve on all the time. Now, basic wound care treatment, it has more or less remained the same over the years, but there is always something new that can add on. We have new dressing types, we have new information about cleaning agents, we have new bandages, we have new types of ointments or salves that can be applied. All of these require knowledge, because again, as much as there are different types of treatment, there are also different types of wounds. And what treatment works for one wound will not work for another. We've learned that over the years. You can't take one plaster, okay, say a Johnson & Johnson plaster, and put it on every single wound we have. We have stabbings, we have lacerations, we have chop wounds, we have contusions, we have abrasions, avulsions. All of these are different types of wounds. They're different levels, different layers. How will you know which is the best one to use for what type of wound, what treatment to use for what type of wound? Also, you have to take into account the underlying conditions your client, your patient is in. Is it that your client is diabetic? Are they hypertensive? Are they a cardiac patient on blood thinners? What conditions are they living in? Are they destitute? Are they living in optimal conditions with family members around who care? Are they living alone and they are limited in their finances? All of these need to come together for us to be able to treat a patient holistically. Just to ensure you cannot just take at face level, okay, this is a laceration, and this patient requires sutures because the wound is however deep, and we just suture it up, put a dressing on it, and send the patient home. What if this patient has limited income and can't eat properly? The different stages of healing require different food types. That's another thing. And my students who in my previous class would know that as well, that is something that was never taught. You don't realize that because when you're going through pathogenesis, you have to have a certain type of meal plan. What do you need more? What do you need less of? What it is you need to omit totally. You need to understand all of that for the wound to heal. Some people, thankfully, seem to heal quite well with very little intervention. And then some people, again, require continuous treatment for months on end. Let's take, for example, a bed sore or the cubitus ulcer, which is the proper medical term. We have a bed sore, and as I like to point out to persons, a bed sore takes 2 hours to form and can take up to 18 months to heal. Right? We have persons who present with a bed sore that looks like nothing. It looks like a bruise. And you really and truly tell yourself, okay. And persons who don't know, family members, caregivers sometimes will look at it and say, oh, it's nothing much. And they'll put some salve on it. And they come back the next day and it's an open wound because it just looks like a little bruise right now when they first see it. And they'll ignore it. And they come back the next day and they realize that it's a large wound there. The skin has broken down and you're seeing it's angry and aggressive and there's heat emanating from it. Give it 3 more days with not proper treatment and you actually see pus oozing out of that area. Why is this happening? What is going on there? What tissue, what layers of skin has it gone through? When is it time for you to really be aggressive with it? Should you do something immediately as you see it? Should you wait for the skin to open? Should you do something to prevent it happening in the first place? For me, prevention is always better than cure. So preventing this is a whole lot better than allowing it to degenerate like that. What is going on? What has caused this to happen? Once you understand what has caused the wound to occur, the treatment method is easy. Once you understand what has happened, it means that you can then plot a treatment plan, even taking into consideration the possibilities of arthritis, the patient not being able to move from the bed, the patient being incontinent, the patient being diabetic, the patient being hypertensive, and on a string ban of medication, some of which, most of which, they can't even tell you what it is. I'm taking one for, when you ask patients, most times they tell you, I'm taking one for pressure, and I'm taking the little green one for my sugar dinner. And the next one, I think the doctor said my cholesterol kind of high, and I'm taking that. But I'll drink some saffron with it, you know. And these are the things we have to be prepared for. And on top of which, a patient presenting with a wound, you also have to do observation on your own. You listen to what the patient says as far as how the wound occurred, when they noticed its eruption, but you also take into consideration what they're looking like, what the rest of their skin looks like. Most persons may know by now that how a diabetic person's skin looks: dry, scaly, flaky, especially on the legs. So if you notice a patient and you ask them, are you diabetic? And they tell you, no, I'm not. No, I don't have sugar. But then you're noticing certain traits. You are getting a smell. You notice a smell coming off of them that smells very wine-like or like alcohol, like a light alcohol smell. You peek and you say, okay, let me check something. You need to check. You cannot ignore this. because ignoring these signs can be the difference between this person developing sepsis and dying, or the patient's wound getting infected to the point where you have no choice but to perform an amputation. And in some cases, some persons have died because of the amputation, either because of depression or because of other underlying conditions. So it's not a be all and end all. So for me, wound care has become a part where I need to know what I can do for you. I see everyone as a potential family member. And that's another thing. If you are into healthcare in any form, any fashion, you need to have a care for persons. You need to have a desire to help. We will never be paid what we are worth, never. Healthcare workers, you get accustomed to that. Healthcare workers will never be paid what they are worth, because you can't put a monetary value on caring. You can't put a monetary value on the love that you have for your profession. And it has to be an inborn something. You take care of someone's leg, somebody tells you, oh, nurse, or oh, Miss Lady, thank you so much for what you've done. You wouldn't believe I feel an ease. That pays sometimes way more than the salary you get at the end of the month, or the money you get paid for the service you perform at that point in time. There is nothing that will ever replace that. And that was my reasoning for getting into wound care. As Shivani pointed out, we are about to start on level 2 of our wound care courses. We are going to go over the level 1, but in the level 2 part of it, we want to do predictive analytics and leveraging analytics to provide a better treatment plan for our patients or future clients going forward. There are so many new methods coming about. Who knows about the fish skin? Fish skin is now being used as a wound care treatment. They're actually taking fish skin and replacing it in areas where persons have been burnt, either chemically or by fire, open flame, and they are replacing, and it's causing rebuilding of skin. Isn't that amazing? Who would have thought that, that would have been possible a few years ago? Some people say, oh, I don't want fish skin on me, or they take skin from persons who have died. So we call that cadaverous grafting, where you take the skin from a dead person and you place it over your area, and you allow your skin to adhere to it and adapt it, and it continues growing. So you don't have the large scars, you don't have persons who have been burnt, and years ago, some people who have been burnt, let's say 20 years ago, 20 years ago, you can look at them now and still see burn scars. People who are getting burnt now, you look at them and you see a difference. The treatment plan is different. The scarring is less, although the damage is just as large. Why is that? What is different? What's the knowledge that's new now that we didn't have then? This is what wound care is all about. This is how we go into the management of treating wounds, because of these things. Right? So I think I've talked nonstop enough. Any questions, concerns, Shivani?
No, not as yet. Anyone got any questions in the meantime? I'll open up the floor if anybody got any questions. You feel free if you want to type it in the chat. If you don't want to talk, but you can open your mics and talk if you want to talk. But in the meantime, I'll ask a question then, Hazel, in terms of level 1 versus the level 2 wound care, right? So we know you did mention that there are things probably we just didn't know before, but now we know. And there's some such great improvements, right? So key takeaways from this conversation so far for me is that technology is changing quite a lot, right? Technology changes. Someone had called me and they wanted to have a wound care. It was a clinic that they were setting up, and they had different equipment that they were purchasing to handle wound care. So I was like, wow, I didn't even know about that. They had such different type of equipment and stuff to do wound care. I was very, very shocked, because until I got a little more interested through you in wound care, I like a lot of different persons will say, well, why study wound care? What's the purpose of that? Isn't that just that if you have a wound, you put a plaster on it and you let it heal, right? So as you said, knowledge is power, and persons need to understand that things over the years have changed. I like that idea, that things have changed, technology is improving it. You also mentioned something that really hit home for me, which was with analytics. Could you tell us a little more about the analytics? Why, how would you, how are you going to do this? What's the purpose of the analytics now? Get a little into that deeper. I like that idea.
Okay, well, well, I know you would love that. You have to take into account everything. It's not just a plain broad-based anything. You have to take all the data into consideration, all the data that you have, all the possibilities or the probability. No one treatment, as I say, will fit everybody. It's not that way. So we need to take analytics. We have to pull the data, look at the data that is provided, and then from that you can draft a plan. You have to be able to have, some data, you have to have some information on the person. It's not just a matter of you look at, so you're walking down the street and someone drops in front of you, and you realize that this person has been struck by, say, a pebble you didn't notice that hit them at high velocity from wherever and gashed them on the side of their head. You see the person drop, and the first thing you're going to think is, oh, this person fainted. But then when you look and you realize there's blood, you wonder, okay, where's the blood coming from? That's information. Where did what was it? You see the stone on the side and you notice some blood on it. You say, okay, so this is what probably hit the person. Where did it hit them? So you investigate to find that out. What is in this area of the body? All of these things have to be taken into consideration. The area of the body the wound has happened in, the type of wound that has been sustained, sorry, and what are the dangers to the patient if it's left untreated for any period of time. All of these things are what are concerned in analytics, this type of analytics. So solutions have largely focused on descriptive analytics, detailing what have happened in the past or is happening now. So you have to take into account what is happening. Descriptive analytics takes into account what is happening now or what happened in the past. I've had this situation in the past I've dealt with. What did I do at that point in time? What was that person's status? Can I apply the same treatment now? If I can't, how do I adapt it to fit this criteria at the point in time?
Descriptive.
Yes. Descriptive, yes.
You mentioned prescriptive at any point?
No,
No,
descriptive.
descriptive.
Yes.
Right.
Yes.
So analytics helping you then having this type of data, if you already have the patient and you already know the patient,
Mhm.
it's really ensuring that you have a proper treatment plan and you go back and you have all the data. So
Exactly.
wound care, as how you're explaining it to us, really, we need to become more data driven. People need to understand it's data that you're working with, data of the client, data of the
Yes.
patient. When I say client, I
There
mean the
is
patient.
always data you are dealing with. This is always data. You are getting information downloaded to you for you to make a determination and spit out a treatment plan.
Mhm.
This is what it has to be.
Just
And
is just off.
yes.
Sorry, Hazel. Yes, you were saying.
No, you go ahead. You go ahead. Mhm.
Right. This is just a little off, right? But I still will ask it. You know, we are managing a lot now with remote. So let's say, what do you think about medical now in terms of if somebody has a problem that you could diagnose it online, or some type of thing like that.
Mhm.
You know, it's a conversation a lot of people I'm seeing having, because it's a global, everybody could be wherever they are and you could get information. Look, I know, well, you are not in Trinidad, you are in France right now, and
Mhm.
I mean, we having this conversation and you taught
Mhm.
a lot of our wound care classes like that.
Mhm.
So what do you think? Do you think that technology can help persons to diagnose, or you have to see the person in front of you physically? Because I see in you and you see in me.
Yeah, but there are certain aspects of medicine and wound care
Wound care.
that is, yes, I can do that without being there. I can see the wound, I can ask certain questions and get that and be able to make a proper diagnosis and form a treatment.
Treatment plan.
But that's because of my years of practice. That's one. So I wouldn't expect any and everybody to be able to do that. But two, there are certain instances, certain things, aspects of wound care that you would require someone there with a little knowledge as well. Because the smell off of a wound, just now, Andrea, the smell off of a wound, I need to get that. I need to know how it's smelling. Is it smelling sweet? Is it smelling off? Is it
You ask the
smelling?
question, you ask
Yes.
the person the question, yeah?
Yeah, but the thing about it is what can be sweet to me may not be sweet to you. I know what kind of sweet I am talking about, right? But I want to get from you the smell of this wound. That is where the problem comes in. Is the wound warm? Now, I have a son who has a core body temperature all the time of 99 degrees. He has no fever, but he's 99 degrees, right? I can't ask him to tell me if somebody else has a fever, at least not without a thermometer.
Got you.
Right? So somebody else, somebody who has that same condition, who will put their hands over the wound and say, nah, it's normal temperature. And somebody else will come, or I will go to that patient and I hold my hand over the patient and I will feel heat. And I said, but this is hot. Right? I am feeling hot. So this wound is really infected because of that heat. Right? The color of the wound, I might be able to see it if your camera is good enough, but you know, there are certain underlying things. I can look at a wound on camera. I can look at a photo of wounds on camera that have been taken and say, okay, that is going to be smelling badly. I am seeing pus there. I'm seeing pus forming on the edges there. Those are things that are important for us to be able to assess and ascertain. Fevers you cannot determine online, and there are certain parts of medical treatment that you just cannot do online. Wound care is one of those that could, to some extent, be done.
Great. I like what you said too. I mean, you need to be a subject matter expert in this thing in order to, you know, especially, I mean, if you're doing it in this type of global way, you know, through technology. So great. Yeah, perfect answer. as usual, Hazel. So Andrea is asking us a question. How do you manage a bed sore in its initial stages? She said she missed the first program. Don't worry, Andrea. We have the program again running at the end of February. So I know we'll see you there. So yeah, and Hazel?
Initial stage of a bed sore. Well, what I like to tell people again, and I'm reiterating what I said earlier, is you need to understand why it was formed. What is causing it? Initial stage of a bed sore, keep the area cool. Keep the area cool.
Okay.
That's basically it. That is basically it. Why? I am not going to reveal that now. I really would like you all to come to the class and find out more information. But keeping an area cool, any area that the person is susceptible to, there are various areas of the body that are susceptible to developing a bed sore. You keep those areas cool. Not only turning the patient, but literally keeping that area cool. If you can apply cold compresses or something that keeps that area cool, something that contains cool water, ice packs, not directly onto the skin, but you can use that to keep that area cool. Right? Once you can do that, that's all you need to do in the initial stage of a bed sore. You will notice the red area. You will notice it. A person will be as dark as what? A bed sore is starting, you will notice it because that area suddenly becomes red. And a very dark person, it looks purple. And anybody who is taking care of anybody who has a propensity to develop a bed sore should be able to observe that. Observation is one of the most important traits we have in wound care, in medicine on the whole, but especially when it deals with wounds.
Thank you, Hazel. I think you answered Andrea's question. Next point. So could you elaborate a little bit on what persons will learn again in this wound care course the second time around, right? Andrea is saying thank you. So what would persons learn at the level 1 versus the level 2? Because I mean, yeah, we're going to be rolling out the level 2, but in the level 1, what are persons going to be learning? Some key things, some key takeaways for that.
Well, we are learning, number 1, you have to learn the type of wounds. You have to learn what are the different types of wounds. They will be learning about the structure of the skin, so they understand wound formation based on the structure of the skin. Because you need to know, you're not going to buy a house and not know how the walls are made. You're not going to buy a wall. Most people will tell you, I'm not buying a cardboard house. Right? Because they want to know that the walls are strong enough to withstand whatever. So we need to know how the skin is constructed, the levels of it, the layers of it, so we know how the wounds develop, right? And how the healing process is. We also will learn about infection control, how you minimize causing infections, because a lot of times infections are brought on not necessarily because of anything the patient does, but something that may be introduced unwittingly by the caregivers. So we need to understand how to do infection control. Then cleaning materials. We are learning that in level 1 as well. Cleaning materials. What are the best cleaners, cleaning agents for wounds? What are the best dressing agents for wounds? We also learn a bit of contraindications where the medicines are concerned and treatment. And we also learn massage. Because what a lot of persons don't realize as well is massage ensures proper blood flow. Proper
Right.
blood flow ensures healing. More red blood comes to the area, the wound heals faster. And this is
Right.
something that has been ignored quite a lot. When you go to the clinics and they change your dressing, basically the dressing is changed and nobody really touches the wound, unless of course it has maggots in it. That's the only time they'll really make any effort to touch, and they do it with tweezers and however it is, just to count the maggots that are removed from the wound. But to say, touch the foot, hold it, and touching is also a healing implement in wound care. Just that physical contact with your client, with your patients, makes a whole lot of difference. You care about me. My wound looks like, oh, I could barely look at it myself, but you are willing to touch me. You are willing to hold my foot, my hand, my stomach, my buttock in some instances, and clean it with such tenderness. It makes a difference. It makes a whole lot of difference. And these are what we teach. This is what is taught in level 1. For level 2, we go into, as I said before, the analytics. We go into various wounds, venous ulcers, and well, yes, that is a holistic aspect, Andrea. But it's also not only holistic. Now, persons think that as just holistic, but what did you get into medicine for? You know, why go into it if you don't want a holistic aspect of it? There is a holistic aspect and there's a medical aspect, but both of them have to work hand in hand for you to get a proper outcome. If they don't work together, then we won't have a proper outcome, right?
Great.
So,
And then you mentioned a level 2.
Yeah, the level 2 we go further into venous leg ulcers and venous insufficiency ulcers. We go deeper into delving into decubitus ulcers as well, to different stages of them. Cancerous wounds, these are the things we are going to be dealing with. And treatment for these types of wounds. These are the different layers we are going into. We briefly touched on it in level 1, but we go more in depth in level 2. As far as infection control as well, we go even deeper into infection control because there are different aspects of it that we just briefly touched on in level 1, that we go even further into in level 2, as well as the different dressing for burns, the 3rd-degree burns, how we are treating those things. So everything we touch on, basically what we touch on in level 1, we go more in depth. So it's more or less like we have a primary school teaching of wound care in level 1.
Secondary school.
And we go secondary school for level 2. So we go even deeper. You write,
Thank you, Hazel.
Yeah, you write essays and dictations for primary school, and then secondary school, you want more words, you want bigger words, you want more depth, you want more feeling, and you're looking for onomatopoeias and metaphors.
Bigger words.
Thank you.
So thank you, Hazel. So great, it's very clear what are the differences with level 1 wound care and level 2. So Hazel, I know we're going to have lots of great information. Again, I'm seeing persons from level 1, Kellyanne. It's already on the call. I think I saw some other names too. So, you know, persons are so interested to continue with the learning, So thank you, Hazel. And we do look forward for February. I think it's the 1st. That's a Thursday. where we will run level 1 wound care, the level 1 wound care again. So we like to thank everyone for being part of this conversation, lunch and learn. I'm hoping, and I'm sure I took away some good key takeaways from this lunch, well, coffee for me and on the go, right? Learning on the go a little bit. So we definitely will see, I'm sure most of us back here again for that particular program on wound care. Thank you, Hazel. Thank you, Hazel.
One thing as well too before we go, if anybody has any questions that they did not want to ask now, they can still submit it.
Email it to us.
And email it, and I will respond to you. That's not a problem.
Definitely. You all have the email address. Everybody knows it. So Caribbean Connect at CaribbeanConnect00@gmail.com. I think everybody would have had it in order to come into the course. So thank you again, Hazel. Thank you, audience. Lunch and learn. And definitely, we would see you all for the wound care program that we are rolling out again on February the 1st. And we will see you on next week. Actually, next week, Tuesday, we have another lunch and learn. This one is Power Up with your data analytics with MS Excel, right? And that's what I was asking you about the analytics. Yes. So we look forward again, many good things to come. All the best for 2023. Let's make learning, power up with learning and development. And we definitely would do the wound care. See you. Thanks again. So we're seeing people telling us, thank you, Hazel.
No problem.
We'll definitely
bye, everyone.
All the best. Take care. Signing off. I know people are getting back to jobs. Thanks, everybody. Bye-bye.
Bye.